Hey, Carla. Hello, everyone. I'd like to welcome all of you to our monthly webinar for bariatric surgery in Mexico. And I'm just waiting for a little bit more of the participant to join us and get started here. Tabitha is asking if so let me go over what are the raffle today about. So basically, if you have not filled out the health questionnaire, which resides at mexicobariatriccenter.com/health-questionnaire/. If you have not filled out the HQ, please go ahead and do so and select Dr. Alejandro Gutierrez as a surgeon of your choice. Now, if it doesn't allow you to select him, you are looking at a surgery that he's not doing. So if you can't, you're not going to be able to enter the raffle. If you have filled out a health questionnaire with a different surgeon, we can switch you, so you don't have to resubmit another HQ. So yeah, so if you have already filled out the health questionnaire, you don't need to switch. We just have to switch the surgeon on our end, and it's easy to do. Okay, well, it looks like we have pretty much everyone joined, at least. So the topic of our webinar has been, for almost 2 years now, the collision of two pandemics, COVID-19 and obesity. It looks like COVID is not going away, but it's getting less harmful to us, at least from my experience. When you get COVID, it's not as severe, but you still are susceptible to this virus. And obesity is also in a pandemic proportion. So these two coming together, it was a health problem for a lot of us. And we're going to go over what we need to do to cure obesity. So another issue that we have today is my name is, by the way, Ron Elli. I'm the CEO and founder of Mexico Bariatric Center. Dr. Alejandro Gutierrez was supposed to be the speaker today for the surgeries and question and answers, but unfortunately, he cannot attend. So what we're going to do is we're going to cover most of the presentation, and hopefully we have another surgeon in Tijuana join us and be able to complete this webinar. As I said, if you have not filled out the health questionnaire, go ahead and do so. Dr. Gutierrez should be the surgeon of your choice. At the end of the webinar, for people who have had the health questionnaire and they are eligible to get the surgery and attended this webinar all the way to the end, get to be entered into a raffle for $2,000 off of our packages, all-inclusive packages. Again, just use the Q&A tab to enter your questions. And we try to answer as much as those questions that we think that's going to come up. So please pay attention. But the ones that we didn't cover and you have specific questions, you can ask and we would answer it at the end of the presentation. The topics we are going to cover today is what is obesity, risk of being overweight. We're going to cover what weight loss surgery can do for you and what we can do for you at MBC, Mexico Bariatric Center. This is the next topic is bariatric surgery options. That's where Dr. Gutierrez was supposed to cover all the options, but hopefully either I try to touch on them or Dr. Rodriguez is going to join me to cover that. And at the end, we will have Q&A session, which we're going to answer all the questions that we haven't covered in the presentation. And as I said, at the end, we will have the raffle for $2,000 off. Obesity is a chronic disease, not in US alone, but is worldwide. Basically, our bodies, human body, is not used to high sugary drinks, processed food, fast food, and we are not used to being inactive, and physical activity was unavoidable throughout the human history. So our body don't have no defense against all these elements. And of course, you know, our genetic predisposition, our environmental exposure, our developmental history, these are all factors in how we do, how much weight we gain or not. Again, the lack of physical activity, stress, you know, the comfort eating, that's a big factor. Not getting enough sleep, the drugs that we may take, and food that we take, high calorie food, is all contributing to obesity, chronic disease. So when we gain weight, not only the fat cells, the numbers go up, also the size and the structure changes. So if you look at my right side of my screen, on the top, it shows adipose tissue or the fat tissue of an obese individual, and the bottom shows a lean adipose tissue. So as you see, the structure is changed, the size is changed, and the changes in the fat cells causes a lot of problems, which includes insensitivity to insulin, insensitivity to leptin, insensitivity to therapies, insensitivity to even vaccination is less effective. So how do we define obesity? Basically, there's a formula, which is body mass index, BMI, that you plug in your weight and height, and it gives you a number. If your number is anywhere below 25, you consider pretty much normal and healthy. If your BMI is between 25 and 30, you are starting to go to the overweight zone, and after that, it's considered obese, and BMI of 40 is morbidly obese, and 50 is super obese. So these are all definitions of when we say, oh, it's obesity or morbid obesity. 40% of adults in US alone are impacted by this disease, obesity disease. Major risk factor, is a major risk factor for a lot of problems. This animation shows you what happens when we gain fat.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So as I mentioned, obesity comes with underlying medical conditions like heart disease, diabetes type 2, stroke, lung disease, PCOS, sleep apnea, certain type of cancers. So basically, chronic inflammation. Now, in case of COVID, so the COVID virus attaches itself to the protein cells, protein in the fat cells. And the more fat cells you have, the more landing area you have for COVID-19 virus, coronavirus. So that's why when we're overweight and obese, we're more susceptible to viruses like COVID. The patients with obesity have 113% more of a chance to end up in a hospital and 74% more chance of being in ICU, intensive care. And 48% are more likely to die. The pandemic itself, it didn't help us. You know, the gyms being closed, the fresh food not being so readily available, that caused even more of a weight gain. But now everything is going back to normal. So we should be able to get back to healthy life. So you would ask me, what are the ways you can cure obesity? Okay, well, the first thing everyone says is diet and exercise and medications. But none of them is proven to be a long-term solution for obesity. And we're going to see why is that in a minute. So But without surgery procedures like gastric sleeve, bypass, duodenal switch, these are quick, safe, and long-term solution to get over this problem. Basically, when we go on diet, if you look at the pictures on my right side of my screen, you see an individual in red, which weighs 250 pounds. At that weight, the brain, the hormones are interacting, which we call a metabolic system, or brain hormones interaction, or you call it body's thermostat. So the body's thermostat or metabolic system is used to that 250. On the right side of that picture, you see this individual does extensive diet and exercise and goes down to 175 pounds, loses 75 pounds by diet and exercise. That's not easy to do, but let's say this individual gets it done. But the brain, the hormones are still used to the 250 body weight. So what is the body, what your system is going to do is going to burn less fat because it thinks like, oh my God, I don't have food available to me. And it's going to make you more hungry. So you have to eat more. That's why the first week you go on diet, it works. And then after that, the body resists it because of this. Now, when you make the surgical procedure, the minute you wake up, your body sees you at a lower body thermostat. Your metabolic system is reset after bariatric surgery. So the individual in the green, right after surgery, even though you're not, haven't lost weight yet, but he sees you at 175 pounds. So you won't be hungry and you're going to burn fat. That's what happens when you get bariatric surgery. It resets your metabolic system. It changes the way your hormones act. It changes the interaction between your brain and your gut hormones. And that's why it's effective, it's fast, and it's long-term because it resets your body's thermostat. There are some insurance companies that cover bariatric surgery in US, but it's hard to qualify. They're running you around, and also people who do not have insurance, is very costly to do this out of pocket expense. So a lot of people, even when they have insurance, they still choose to go with medical tourism. Medical tourism is basically going across the border to get a treatment that is not available in where you live or is not cost effective where you live. Of course, not all medical tourism companies are created the same. You have to be careful. You have to do your research, make sure what company you go with, and they've been around for a while and they know what they're doing. Read their reviews, read their surgeon expertise. And MBC, Mexico Bariatric Center, is in the forefront of bariatric surgery in Mexico. And we've been around 10 years. And we are a US-based corporation in California. Our headquarters is in Sacramento. That's where I am right now. And our mission since the inception has been helping patients cure obesity by providing high quality weight loss procedures in Mexico. But our prices are affordable and we are very competitive as far as price concerned. So as I mentioned, 10 years in medical tourism, more than 18,000 successful procedures performed. And right now we work with 7 top quality bariatric surgical team in Mexico. That's in Tijuana as well as Guadalajara. Our process is very simple. You fill out a health questionnaire, we get your approval from the surgeon for the procedure you're asking, or is the best for you. You make a deposit of $350, then you're eligible to get on the calendar. We put you on the calendar, then you get your flight or arrange for your driving to San Diego. And of course, in Guadalajara, you just fly to Guadalajara and you finish your paperwork, pre-op, post-op diet, all that stuff, and you're ready to go. We offer all-inclusive packages, which you don't have to worry about pre-op medication, post-op medication, hotel, transportation. We do have nutrition support, aftercare, and we do work with a surgeon liaison that works between you and the surgeons. You asked me when is a good time, I would say today. We still are okay handling COVID. You know, the prices are extremely affordable, especially after such a high increase in all of our expenses daily with the inflation. So I would say this is a time to do it. We are one of the companies that came out of COVID, shut down, and we were the first one actually to start operating because we figured out how to handle this challenge. And we've been open since then, and we've been very successful at what we're doing. As I mentioned, you either fly or drive to San Diego International Airport. By the way, we have 2 terminals in San Diego, and the terminal 1, which is Southwest, is going through renovation. It's going to be actually very nice soon, hopefully. And Terminal 2, which you have Delta, United, all those go to Terminal 2. So we know which flight you're getting because it's in your file, you let us know. So the driver knows your arrival time, he knows your departure time. So we know to manage all pickup, drop off. And when you just land, basically you have the driver's phone number because they contacted you the day before departure, and you tell them which letter on the sidewalk you are, and they come and pick you up. It's very simple. As I mentioned, we have 7 team of surgery experts, Dr. Miguel Montalvo, Dr. Luisiana Valenzuela, Dr. Alejandro Gutierrez, which was the speaker today, but unfortunately he's not available, and Dr. Rodriguez Lopez, which I'm hoping that he would join us, Dr. Jacqueline Usuna, which is our surgeon that travels between Tijuana and Guadalajara, and Dr. Jesus Ceja, So this is the best of the best team that you can find anywhere in the world, actually, because there is no procedures that we can't perform almost between all these expertise that we have. Like I said, the procedure is very simple. You fill out a health questionnaire. Our surgeon liaison, which is a bilingual doctor, sits between you and the surgeons, and they handle the review of your HQs. Make sure that your case is handled by the right surgeon, and you are getting the right procedure. That's very important. Everybody just look at, the company, they all look good, but at the end of the day, you want someone to give you specifically what you need. As I always mention, just a moment. Sorry. So as I always mention, we don't give our patients one size fit all. And that's very important, because let's say if you go to buy a jacket and your size is large and medium is all they have, they try to fit you in that medium jacket, but that's not what you need. I have example after example when I see, for example, patients that, let's say you need a bypass and your BMI is over 50. Not every surgeon can perform over 50 BMI, or some revisions of VBG to sleeve or bypass. So what I see from other centers is they say, okay, well, we can't perform this, but we give you sleep, but you really need bypass. This is a life-changing experience. This is a one-time deal. And once your guts are rerouted or rearranged or cut, it's very hard to undo it. So, so that's what we see in other centers, that they just want to take money and they don't really care what the patients get. And this is what you have to be careful of where you go to. The expertise you get from MBC is probably untouched with any company because of the amount of expertise we have in-house. And that's where you want to go, because of what they're capable of doing. Not so much the price and some other factors. So that's what I recommend. You do your homework, you do your research to know what's the difference between MBC and other companies. We use 2 hotels at this time. We use Hyatt Place on the night you arrive, and we use Marriott Fairfield in Tijuana. We want you to relax and have a good night when you arrive. And we do all the pre-op tests when on the day you arrive. We actually like you to arrive before noon, and your departure after 1 p.m. You get broth, jello when you're in the hotel, and your companion gets free breakfast. After surgery, you basically fly home or you drive home. One of the reasons MBC is so successful. So we have one of the highest rate of success, and we have one of the lowest rate of complications. And one of the reasons we are so successful is our surgeons' load management. So what we do is we give enough surgery to each surgeon per day. And we don't do like one surgeon do 10 or 15 surgery in one day. This is not what we do. We have load management for our surgeons, and that's one of the reasons our complication rates are less than 0.5%. It's not even 1%, 0.5%. And these are simple complications, maybe wound infection and things like that. This chart basically shows different options available to lose weight. Like I said first, the diet and exercise, medication, endo procedures, and laparoscopic procedures. Endo procedures like gastric balloon, ESG, and bariatric surgeries like gastric sleeve, bypass, duodenal switch. This chart kind of shows what age, what BMI you qualify for what procedure. Gastric band, we're not doing gastric band, and we actually taking him out every day because even though it's supposed to be a reversible procedure, but it's creating a lot of problems long-term for patients. You can actually die from that band. And VSG or gastric sleeve, that's our major patients go through this. We do mini gastric sleeve, and we do single incision gastric sleeve. We do RNY bypass, mini bypass, duodenal switch, single anastomosis duodenal switch, SADI. Different revisional procedures, even bypass reversal, and of course, all the endo procedures like gastric balloon, endoscopic sleeve gastroplasty, which we call ESG, we offer all those. And this is the endo procedures, as I mentioned. We do a revision of a bypass endoscopically, which we call TOR. If your pouch is enlarged and you don't feel restriction anymore. I was hoping that by now, Dr. Christian Lopez would have joined us. But I'm going to continue as best as I can. So let's go over procedures. Again, about 90% of our patients are receiving VSG or gastric sleeve. In gastric sleeve procedures, basically, the stomach is cut and stapled, and its size is reduced to 15 to 20% of what it was before. So what happens is you get restriction when you eat, and you can eat big meal. And the top of the stomach on the right side, where the majority of hunger hormones reside, is taken out. So you lose a bunch of hunger hormones and you don't get hungry as much. And this is where the hormonal change comes through. You know, remember when we said bariatric surgery resets your metabolic system, it resets your body's thermostat. And this is how it's done because the hormones are changed. Now, as a result of hormonal change, also you feel full faster because you be more sensitive to leptin protein, which is responsible for satiety. We see patients with gastric sleeve that lose almost all their body weight. You read in the books and online that, well, you lose 70% of your excess body fat. But there is no limit. This is a tool that you acquire and depends on how you use it. If you change your lifestyle, if you change your diet, which you're forced to do because you know your stomach is new, you get a new stomach, you get a new start in life. And so if your diet is right, if you start being active, walk, run, do exercise, there is no limit. You can go to your ideal body weight with gastric sleeve. Of course, there are some exceptions that you really need to receive a bypass or DS. But in general, gastric sleeve works very well. So the surgery itself from start to end is 1.5 hours, but the surgery itself is about 40 minutes. You stay 2 nights in the hospital with us, and the recovery lasts about 3 weeks. So what we want you to do is take it easy and don't get yourself exhausted. Don't lift heavy weight. And when we say heavy weight is anything less than 25 pounds. More than 25 pounds, you don't want to lift. Don't go to the gym and start lifting heavy or, you know, run heavily. So you may want to take it easy at least 3 weeks. And for weightlifting and things like that, at least 6 weeks to 8 weeks. As I said, gastric sleeve, it creates a sleeved stomach, and you have restriction, which means you have less portions. You can eat less portions, and your hunger hormones go down, and you feel full faster. A rather new procedure, which is endoscopic gastric sleeve. Basically, it imitates the gastric sleeve, but it would do it instead of making holes in the stomach wall, tiny holes, of course, laparoscopically. It would go through your mouth and it would stitch your stomach smaller. It cannot make it as small as a sleeve. And remember, there is no hunger hormone removed. We just make your stomach smaller. So this is a good procedure for people who do not want to cut their stomach or their BMI is close to 30. And they are disciplined because, again, this is not going to do the trick because it's not changing your hunger hormones. The procedure is about 30 to 45 minutes and you stay one night in the hospital. The iron wide gastric bypass, which is a gold standard for bariatric surgery, it not only it creates the restriction in your stomach, which creates a very small pouch, about 1 to 2 ounces. It also reroutes your intestine where the food is getting absorbed. The nutrients in the food are getting absorbed. If you look, the intestine is bypassed and the food goes, if you follow the red arrow, the food follows from a small pouch to the intestine directly, and food gets mixed with the digestive juices, which is in green, coming down the bypassed stomach. And so you have malabsorption as well as restriction. Of course, because of the malabsorptive components, this could be yielding higher weight loss. But then again, you need to be on vitamins and supplements forever almost, and at least the first 5 years, 3 to 5 years. And we get to the vitamins at the end. And basically, it may be better for curing metabolic problems like diabetes type 2, cardiovascular problems. So this could be a more effective procedure. But then you ask, why would I get bypass and not get sleep? So if you look at here between the sleeve on my left and bypass on my right, you see that if your BMI is more than 30, you're eligible to receive gastric sleeve. For bypass, we reserve at least a BMI of 35 unless you have some comorbidities that is going to create a problem. And basically, if you have problems with acid reflux and GERD, depends on what causing it. We're going to go over this again. What causes the acid reflux? You may have to receive bypass, and sleep may not be a good procedure for you. And if you have a slow metabolism, you may want to go with the bypass. And if you like sweet, you may want to go with the bypass. Again, sleeve versus bypass chart. A simpler version of bypass doesn't mean it's not as effective. It's just the way they do it is instead of 2 anastomosis. Anastomosis basically is where you connect the intestine. So you saw, I'm going to go back and show you. So you see there are 2 connections, one up here and one down here, whereas mini bypass, it only has 1 connection, 1 anastomosis, but it does the same thing pretty much. This is a newer operation, but as effective. This is probably a good option if you haven't lost enough with sleeve and you want to get a second surgery. revisional surgery, this could be a good option. But is gaining popularity. So that's the difference between RMY bypass and mini bypass. And as I mentioned, duodenal switch, which is so duodenal switch is a more intensive procedure than bypass and RMY bypass because it bypasses even more of the intestine. And it's reserved for people who are morbidly obese or they have severe metabolic conditions. But of course, you lose more weight, is more effective on curing underlying medical condition associated with obesity. So, and then of course, I didn't go over SADI, which is DS, again, with one connection instead of two. That procedure is also gaining popularity, is a little simpler to perform, as effective as DS, and it can be used as a primary surgery or it could be a revisional option for sleeve to SADI. Are we still doing COVID, wearing masks, social distancing? Please try to do a test, even in-home test, before you depart for yourself and your companion. If you bring in companion, of course, vaccination is a great thing to have. This chart basically shows you when you can return back to work. So if your job is sitting, firstly 1 to 2 weeks, mini bypass for 1 to 3 weeks, duodenal switch 2 to 3 weeks, gastric balloon 1 to 2 weeks. For walking, fast-paced, and lifting, as you see, for lifting, you need at least 6 to 8 weeks. I would wait 8 weeks to be sure, you don't hurt anything. But again, this is a laparoscopic procedure done, so you're not going to be having a lot of pain, and it's pretty fast recovery. As far as financing, we have options on our website that it's personal loan. We have United Medical Credit and e-financing. They're all on our website. You can click on it and go there and fill out application. We get to the part where we are opening for question and answers. I'm going to, unfortunately, Dr. Rodriguez still is in surgery in Tijuana, and I cannot have him answer questions. So I'm going to do my best to answer the questions. Just a moment. So one of the subjects was pre-op diet. Our pre-op diet is based on your BMI. If your BMI is close to 30, 35, you only have to do a 2-day clear liquid pre-op. And as your BMI goes higher, the number of days goes more that you have to do actually low carb, high protein pre-op diet. And it could be up to 2 weeks, depends on your BMI, or more even if your BMI is really high. The better job you do on the pre-op, the better job the surgeon can do. It will be an easier surgery on you and the surgeon. So try to do a good job on pre-op. That's very important. So one of the things that is coming up is Dr. Gutierrez has to approve your procedure, which means some of the procedures he doesn't do. So you cannot get in the raffle, we cannot offer that. So you only get the procedures that he offers. Okay, so when you fill out your health questionnaires, please make sure that you are putting all the medications you take, put all the surgeries you have had prior, and it's complete. Therefore, we can do the right recommendation. Also, you be notified that you'll be notified the medication that you have to stop. Like they tell you, oh, stop this 1 week, or maybe don't take Advil 1 week prior to the surgery. Blood thinners, everything you take, they're going to give you directions of what to do with that medication. So okay, so we talked about restriction in the sleeve, in the restriction in the bypass, and bypass having two components, which is this, which is restriction plus malabsorption. Does stomach stretch? That's a question. Not really. For example, gastric sleeve, you can never get your stomach the same size as it was before. What happens is really for gastric sleeve, you have to, the first 2 years, you lose all the weight, and you just have to create a lifestyle, eating habits and lifestyle activity that would create a long-term success for you. In the bypass case also, you can lose the restriction, and that's why we do the endoscopic revision of the pouch to make the restriction back to what it was before. But once you start losing that restriction, you're going to gain weight. So, of course, you know, you don't want to have carbonated drinks. You don't want to overeat, you know. Again, this is a tool that you acquire. You could use it the best you can and create a new life for yourself and go back to the weight that you want, to your ideal weight, to your goal weight, and that's what happens. So the minimum BMI that we qualify you is pretty much 28, depends of which surgeon we talk to and what are your comorbidities. Sometimes they qualify you because you have some kind of diabetes type 2. Your BMI could be still low, but because of that condition, they may take you. So there is no limit of how much weight you can lose. Again, this is a tool. We see patients that they lose 200 pounds with gastric sleeve. So we highly recommend you get a passport card or a passport book. So when you're coming out from Mexico to US, you won't have any issues, and they don't pull us to the secondary. So for Tijuana, you can fly to Tijuana, but the best option is to fly to San Diego. And then from San Diego, our driver pick you up, take you to our facilities, which is about 25 minutes away from the airport if there is no traffic. Okay, so if you're driving, you can park at San Diego International Airport, go back to the airport for a driver to pick you up. If you want to cross yourself, that's okay. You can go directly to our hospital and hotel. And yeah, the Sentry Pass, it will help you when you go back to US. Yes, we do the TOR procedure, which is the revision of a bypass. All of our surgeons use drain tube, and they remove it when they're releasing you from the hospital. The passport is really depends on where you live, whether you want a passport card or a passport book. You can also get services to give you a faster return, to get you faster passport. We also recommend, especially for revision patients, to do a blood test before you come. We are going to do our own blood test, but for you to do that, it helps if your hemoglobin is down, then you can take iron or do something before you arrive. Okay, so they're asking, what's a single anastomosis duodenal switch? Let's see if I can bring. So basically, yeah, that's the one I'm sharing. So this here, it would show you the difference. Like I said, in the duodenal switch, which is a conventional or traditional DS, you have two connections. One is, as you see, the bowel is divided and connected to the sleeved stomach. And there is another connection with the other loop down here. So there are two anastomosis or two connections. Let me see if I can, okay. And with the SADI, which is single anastomosis, they basically bring the intestine and connect it to the sleeved stomach only in one connection. So instead of two connections, you have one. As you see, the food comes with the white is the food flow, and the green is bile and digestive juices coming. They get combined at this position, and they become the red arrow, which is the food after it combined with digestive juices that goes down, and you see how much is bypassed. And this is the common channel here. That's a SADI. Okay, so they use a linear stapler to cut the stomach in gastric sleeve, for example, case. But the staples are titanium and they're going to stay there. Yeah, because you want to have your stomach sealed. Now, this is a good picture here. Some of our surgeons, like Dr. Valenzuela, only use 3 ports instead of 5 if you do a good job on your pre-op diet. Basically, yeah, so the stapler staples and cuts at the same time, but the staples are not going to go anywhere. Actually, we use reinforced gastric sleeve, which is suture over the staple line. That's another safety measure that our surgeons do. In case of VSG, we keep you almost 2 nights in the hospital. Iron-wide bypass in general is not reversible and is very hard to revise to any other procedure. Dr. Rodriguez can do reverse of a bypass if you lose too much weight or whatever. In some occasions we can reverse it, but it's not easy to reverse. Dr. Gutierrez does single incision gastric sleeve, but again, on a limited basis, and you have to get approved. Okay, so since pandemic, COVID, we, for the safety of our patients, safety of their companion, safety of our staff, safety of surgical team, safety of hospital staff, we did not allow the companion to stay overnight in the hospital. And we keep it the same still. So the companion stays in the hotel. They can come and visit on a limited hours, but they're not staying in the hospital at night, which is a great thing for everyone's safety. So basically, after your surgery, you get up a few hours after your surgery, you can still walk, and we recommend that you start walking so you recover faster. But then again, we don't want you to jump up and down or go back home and start lifting and doing exhaustive things. COVID vaccinations are not mandatory. The surgeon actually can tell you if mini bypass or bypass is a better option for you, but usually mini bypass is reserved for revisional of sleeve. Okay, so we want you to arrive before noon and leave after 1 p.m. And the reason is we want to have enough time to do all the pre-op tests. Now, if you arrive late, we recommend that you stay in San Diego side. Thank you. And then the driver pick you up the next day. So if you arrive at 10 p.m., well, we have some late pickups. I don't know if you go down to 10 p.m., it could be 9. With the extra charge paid to the driver, we can get you picked up, I think, as late as 9, maybe 10 p.m. But again, the other option is to stay in San Diego airport, one of the hotels, and just get picked up the next day. We don't require vaccination, like I said. If you don't have problem with reflux, so here's the thing with reflux again. So depends on what causes the reflux. And sometimes, most of the times, the reflux is caused by being overweight. So if that's the case, when you get the gastric sleeve, you're actually going to resolve that. And about 10% of people who receive gastric sleeve have problem with GERD and reflux that they have to actually reverse it to bypass. But you need to find out why is it that you have reflux, and then we can determine if sleeve or bypass is better for you. So pre-op test, pre-op diet, again, depends on your BMI, can be as little as 2 days clear liquid, or it could be 4 weeks or 6 weeks. If your BMI is 60, 70, 80, you really need to go on a pre-op diet. when you fill out your health HQ, you can ask the surgeon, what procedure is best for me? And remember, you're still gonna have a chance to talk to the surgeon before the surgery. It's not like if you signed up for RNY, you're going to get RNY and we're not gonna talk to you again. So you can still ask the surgeon and you can still change your mind right before surgery. So no problem. So don't get like, it's not like, well, I signed up for bypass and this is what I'm going to get. No, we can still switch you to sleep if it's better for you. We still have opening. Maybe it gets more limited, but I would say just check with your coordinator, see for the date. Of course, right now, maybe the next 1 or 2 months could be still limited spots available, but end of the year, the same thing. A lot of people are booking for end of the year, so get the dates that you want. The sooner you act, the more options you have. Hydration is huge after procedure. Remember, your stomach is reduced, the size is reduced, so you need to drink more often so you don't get dehydrated. That's a huge issue that we see in patients. So make sure you drink up all day. If you go back home, we call a short-term complication and a long-term complication. Short-term complications happens maybe the first few days after surgery, and then long-term, maybe after a few days, 4 or 5 days a week. Leak is one of the things that happen in short term. That's why we do 3 tests for leak. We put a drain, we watch you, we keep you in the hospital watching you. So once you're done, there is no chance of leaking unless you don't watch your diet or lift heavy weight. So when you go back home, if you have complication and it's serious, you want to go to the emergency room. Of course, if like your wound is not healing well, you can send us a picture and we can tell you like, okay, what to do, things like that. The package is all inclusive. However, you can still expect more charges down there. What would be the case? Let's say if they are fixing if they're doing your sleeve and they see, oh, your hernia needs to be repaired. Hernia repair is huge because if you don't fix the hernia during the sleeve, you're gonna have reflux problem. So our surgeons take time to check on those and make sure. And then if they fix it, there would be like $300 some for that. So these are the fees that may still happen when you're down there, but then you may need extra things beside the package, and that's when the fees kick in. But other than that, if you're standard, everything is standard, there is no extra charge. Okay, so we see some patients that lose weight, but then they regain some. But normally you cannot go back to your original weight. You may not get to your ideal weight or goal weight, but you can very hard to go back to the weight that you start before surgery. And you still have the tool. Remember, you can use your tool to go back and lose more weight. If you need revision, then that's a different story. We do FMLA paperwork. Kathy in our office does that. Yes, we send you back with pain medications. We do TOR procedure, which is a revision of bypass. If you do your HQ correctly and your hemoglobin, everything checks, usually there is no reason for surgery not to be able to be completed. We recommend that you wait at least 1 year before you get pregnant. That's very important. So what happens is when you lose weight, there's more of a chance that you get pregnant. Actually, that's losing weight and bariatric surgery is a factor that helps pregnancy for men and women because it changes the hormones. So you are more prone to get pregnant. So that's why you have to watch and don't get pregnant at least 1.5 years out. We see that often. And that's not good if you get pregnant before that. Of course, again, I'm not going to be able to answer anything really related to medications. The surgery does help PCOS tremendously, yes. So BMI, there is a calculator on our homepage, for example. You go in there. Let me show it to you. So share. Okay, so on our homepage, if you go down, you see here? So if I put like 5'8", and I put 175, BMI is 26.6, which is still within range. And if I put the same 5'8", and I put 225, all of a sudden the BMI is 34. So that's called obesity at that range. Go back to answer. If you don't have, if you're not a permanent resident, you need to get a visa to come back to US. Yes, we could do revision from sleeve to bypass or mini bypass, or even do the null switch or SADI. SADI, yes. Yes, for sleeve, you spend 3 nights total. For bypass, and duodenal switch, you use 4 nights total. Okay, so they're asking about vitamins. Actually, I'm going to jump to the vitamins. We carry Emerge Bariatric Vitamins, which is one of the best as far as ingredient and quality in the industry. It comes in soft chew, chewable, drinkable, and capsule. You go to emergebariatrics.com, or you can order it when you do your consent form, and it will be shipped to you. You could go online and purchase it as well. So this vitamin is specifically made for bariatric patients, according to ASMBS requirements. You can take multivitamin, but it's not the same because it does not have the ingredient that your body needs after surgery. So, so I would recommend highly for sleep patients, at least the first 2 years on bypass and DS, to take this indefinitely. You can bring dollar or pesos. Maybe it's okay to have pesos in case, but dollar would work, no problem. We don't need medical records as long as your HQ is approved. Sometimes our surgeons ask for additional tests, maybe heart stress tests or things like that, but we will let you know. Single incision is a little faster recovery because you only have one incision, but still is the same as a sleeve, regular sleeve. And you, of course, some of it is cosmetics too, because you only have one incision. We do blood tests on our own, and basically we want to make sure everything checks for your surgery. If you have any question, you can send your blood test to us and we can show it to our doctors. I would say about 5 to 10% of people long-term may need revisional surgery. Yeah, if you have a sweet tooth, its bypass is better for you. But remember, with bypass, you have a problem. Well, I wouldn't say a problem. It's an issue with dumping syndrome. If you eat sugar or things like that, you may get this rapid rush that it doesn't feel good. So that's called dumping syndrome. Again, if you come maybe as late as 9 p.m., we can still pick you up with extra charge. So after you go back to San Diego, to US, to fly back home or drive back home, make sure you don't sit down for a long time and you wear compression socks. So if you drive every hour or two, maybe get up and get out and walk around. If you're in the plane, just get up and walk around. We don't, I mean, the vaccination is great, but we're not enforcing it as a requirement. Okay, so if you have complications when you're in Mexico, which happens rarely, and usually it could be more like bleeding. Of course, we pull you right back to the surgery and we do intervention. there are some costs that usually is not, bank breaking, and we deal with it at that time. But don't worry, if you have any issues down there, the surgeons are actively watching you. Okay, so if you have hiatal hernia, we're not talking about umbilical hernia. Hiatal hernia, they can fix it during the surgery, and they will, because it will be better for you to get fixed so you don't have to do another surgery. The prices that we have is included with tax. And if you pay with credit card, there's extra fee, but nothing else has extra fee. No, that's the whole idea. To bring a companion, the extra charge is for extra hotel nights. So if the companion has to stay there 2 nights for sleep or 3 nights for bypass, you'd be 145 multiplied by those nights, and that's the extra charge. If you have a long flight back home, you may want to stay one more night. Again, get up and walk in the plane. We do offer cosmetics after plastics after bariatrics. We do work with board certified plastic surgeons that are specialized in after weight loss surgery patients. That's very important. The dental switch starts at $79.95. Your surgery needs to be paid in full before your procedure. Yes. So Mexico Cosmetic Center is the company that we have that deals with loose skin after surgery. Usually we don't recommend re-sleep. So if you have not lost enough weight with sleep, you probably want to go to bypass or a mini bypass. When you go back home, the only thing we recommend is that you do a blood test maybe 3 months after, make sure all your vitals are checking. Again, I am in our office in Sacramento, California, and our facilities that we use is in Tijuana or Guadalajara. For Tijuana, you fly to San Diego or drive to San Diego, and for Guadalajara, you just fly to Guadalajara. Okay, well, we are getting to the end of our presentation. I pretty much covered as much as I could for the questions and answers. We have a Facebook support group that has about 10,000 past patients. We also have another group, which is for people who are not sure they still want to go with us or they want to get surgery. That's another group with 2,000 or maybe 3,000 patients, as well as candidates. So we can, that's a great place for you to get support before and after. Is huge. and our patients share their success rate, their stories, their experiences, and they can ask questions and see how the other ones that gone through this are doing. Okay, so I have the raffle here. You would just hand it to me. Sorry. So this is all the names that qualify. Again, your HQ and your attendance all the way to the end of this webinar is the criteria. And I'm going to shake it up and pick a name. Okay. Wow. That's the winner of our webinar. Let me see if Nint Juan Fininet. I'm sorry if I didn't do a good job. So I'm going to see if that person still is on and let you talk. Are you there? Can you raise your hand so I can let you talk? Unfortunately, I don't see you to let you talk because we like to have you talk and share your experience with us. Let me see. Okay, well, this is the name. Again, call our office here, 855-768-7247. I appreciate all of you spending your time with us today. I hope that this was informative. I apologize for Dr. Gutierrez not be able to cover, and hopefully we see you either in Tijuana or next month in our webinar. Thank you so much and take care. Goodbye.